Assalamualaikum to our lecturer. Today, our group will be presenting on the work processes involved in the implementation of digital transformation at Gleneagles Hospital. So in these slides, we will focus on our 4 key processes practiced during digital transformation, such as horizon scanning, internal audit, new model generation, and gap analysis. In this section, I will discuss the horizon scanning for the selected work process, which is the electronic records management system implemented by Gleneagles Hospital. Firstly, evaluating the external environment, the healthcare industry is currently experiencing rapid digital transformation driven by technological advancement, increasing patient expectations, and stricter regulations regarding data privacy and healthcare standards. To remain competitive and provide quality healthcare services, Gleneagles Hospital has adopted digital technologies such as the Cerebral Plus electronic medical record system, My Health 360 mobile application, telemedicine services, and social media platforms to improve patient engagement and operational efficiency. In addition, the hospital must comply with standards and requirements established by accreditation bodies such as MSQH and JCI to ensure quality healthcare and patient safety. Secondly, discovering what is happening in the industry. Currently, healthcare organizations are moving towards paperless environments and integrated digital healthcare systems. Gleneagles Hospital has embraced this transformation by implementing electronic medical records and digital healthcare services such as e-health check and e-health consult. These technologies reduce manual work, improve access to patient information, and enable healthcare professionals to provide services more efficiently. As a result, digital systems have become an essential component of modern healthcare management. Thirdly, what is on the horizon? Looking ahead, several emerging trends are expected to further transform healthcare services. One of the major developments is the adoption of artificial intelligence, or what we call AI, which can assist healthcare professionals in diagnosis, automate administrative tasks, and improve decision making. Another trend is the use of cloud-based electronic health records, which provide better accessibility, scalability, and disaster recovery capabilities. Furthermore, stronger cybersecurity measures such as encryption, multi-factor authentication, and advanced threat detection will become increasingly important to protect sensitive patient information. The demand for telemedicine and mobile healthcare application is also expected to continue growing, allowing patients to receive healthcare services remotely and manage their records more conveniently. These developments indicate that healthcare organizations are moving towards more intelligent, connected, and patient-centered healthcare system. Next, explaining why the work process was selected. The electronic records management process was selected because it represents one of the most important processes in hospital operations. This process covers the creation, storage, maintenance, preservation, and disposal of patient records, ensuring that information remains accurate, secure, and easily accessible. Furthermore, effective records management supports communication among healthcare professionals and contributes to the delivery of high-quality healthcare services. Lastly, the rationale of selecting this work process. So the rationale behind selecting this work process is that it aligns with the objective of digital transformation. Electronic records management improves operational efficiency by reducing paperwork and minimizing human errors. It also enhances patient safety, strengthens data security, ensures compliance with healthcare regulations, and provides better access to information. In addition, the implementation of digital records supports sustainability through a paperless environment and improves the overall patient experience.
Hi, my name is Rida Alia, so I'll continue with the internal audit. So what is the system or work processes in Gleneagles Hospital? The first one is closed-loop medication management, automated dispensing or verification by the clinical pharmacy team, and barcode medication administration BMCA at the patient's bedside. Second, Hospital Information System HIS relies on Electronic Medical Record EMR systems and the system governing the Computerized Provide Order Entry CPOE. The third one is clinical pathways and evidence-based medicine. Step-by-step clinical pathways are established for high-volume or high-risk procedures. For example, acute myocardial infarction. The fourth one is omnichannel patient touchpoints, which is the digital workflows extend the patient experience using platform MyHealth 360 app, which integrates appointment scheduling. Next is the availability of skill set. The first one is medical and clinical expertise. Features over 220 plus specialist doctors covering more than 40 medical specialties. Second, continuous upskilling. Regularly sending clinical, nursing and administrative teams to top-tier quality training programs. The last one is technological competency. The Gleneagles Hospital retains team proficient in cutting-edge medical tech like Mako Smart Robotics. Next, what is working? The continuous re-accreditation by Joint Commission International JCI and the Malaysian Society for Quality in Health. Second, the Gleneagles Hospital consistently maintains exceptional success rates and low complication rates for critical procedures. And what can be improved? The audit continuously target areas like reducing friction during digital transition and optimizing care delivery times during peak outpatient hours. The last one for internal audit, who is responsible for the work process? The Executive and Strategic Oversight, CEO of the hospital and Executive Board drive the overarching regarding digitalization and clinical effectiveness. The second one is operational and departmental level, which is head physicians, nursing managers and unit coordinators take responsibility for day-to-day medical protocols. How many people are involved? In the Gleneagles Hospital operates within a 76,000 strong global team under IHH Healthcare.
Assalamualaikum and hi, my name is Jah and I'll continue the presentation for the new model generation. Gleneagles' current EMR system is considered to be modern and up-to-date with the current technology in the world. But of course, we can always do better and improve the system as there's constantly new technology emerging. Let's start with the first one, smart preventative care. Right now, the old way of doing things is completely passive. You go for a health checkup, the hospital saves your blood tests, results in the system, and the data just sits there cold until the next time you come back for a checkup or when you're sick. The digital transformation fix? We build artificial intelligence or AI directly into the database. The AI constantly scans past test results across thousands of patients. If it notices a patient whose blood sugar has been creeping up slightly over the last 3 years, it flags it. The system then automatically sends a message to the patient's phone app offering a personalized diet and lifestyle package. Instead of waiting for people to get sick and treating them in an emergency, the hospital uses data to sell wellness before the sickness happens. That is a completely new way of doing business. Moving on to the second one is the hospital at home model. One of the biggest problems physical hospitals face is the shortage of beds. There are only so many rooms available. The old way of managing this is keeping a recovering patient in a hospital bed for a week just to monitor their heart rate or blood pressure. With digital transformation, we connect the hospital's record system directly to the smartwatches and medical wearables that patients wear at home. Instead of lying in a hospital room, a recovering patient can go home to their own bed. Their heart rate and vitals stream live to the hospital's EMR system 24/7. If anything looks weird, an alert pops up for the nurse on duty. From a business perspective, this means Gleneagles can charge a subscription fee for home monitoring while freeing up their expensive physical beds for critical cases. The third one is instant insurance approvals. If you've ever been to a hospital or had a family member admitted, you know that the paperwork and insurance process is lengthy. Usually when you get discharged, the medical records office has to manually print out forms, sign them, and mail or fax them to the insurance company. This back and forth can take anywhere from 3 to 14 days. It is slow, frustrating, and wastes a lot of staff time. The new approach connects the hospital's EMR directly to the insurance company's system using secure digital networks. The moment the doctor clicks discharge on your computer, the system automatically packages the diagnosis code and sends it to the insurer. The claims get approved in seconds, not weeks. This saves the hospital massive amounts of money on paperwork and admin staff. And it makes patients incredibly happy because they can go home without waiting around in the lobby for hours. Last but not least is passport-free medical records. Gleneagles is a major hub for medical tourism, meaning patients traveling from countries like Indonesia or China are more likely to get treated here. But right now, medical records are stuck in silos. If you get a scan in Indonesia or China, the doctors in Malaysia usually can't see it. You have to bring a physical copy or repeat the expensive tests all over again. By upgrading to a modern, unified cloud system, we create full data mobility. A patient's medical history safely travels with them across borders digitally. When an international patient steps into Gleneagles, Malaysia, the doctor instantly sees their entire global medical history. This makes Gleneagles the absolute preferred choice for international travelers because their care is seamless. To wrap things up, digital transformation isn't just about buying faster computers. It's about taking an asset the hospital already has, its patient data, and remanaging it to create preventive care, remote hospital beds, instant paperwork, and borderless health records. That's all from me. Thank you.
Hi everyone. Next, I will present the gap analysis for Gleneagles Hospital's digital transformation journey. Gap analysis evaluates the difference between the hospital's current digital capabilities and its desired future digital healthcare ecosystem. This analysis focuses on three key dimensions, namely data, people, and skills, while assessing how effectively the current digital systems support patient care, treatment processes, surgical services, and operational efficiency. Although Gleneagles Hospital has successfully implemented electronic medical records, MyHealth360 telehealth services, and various digital healthcare platforms, several opportunities remain to further enhance automation, artificial intelligence adoption, predictive healthcare, and advanced clinical decision making. First, let us look at the data gap. Currently, Gleneagles utilizes the Cerebral Plus electronic medical record system and MyHealth360 platform to digitally store, retrieve, and manage patient information. These systems support appointment scheduling, teleconsultation, laboratory results, billing information, and health monitoring. Healthcare professionals can access patient records electronically, improving coordination and efficiency across departments. However, the future state of healthcare goes beyond simply storing information. A smart healthcare ecosystem would leverage artificial intelligence, machine learning, and predictive analytics to transform healthcare data into actionable insight. For example, AI can analyze patient history, laboratory results, diagnostic imaging, and risk factors to identify diseases earlier, recommend personalized treatment plans, and support clinical decision making. In surgical services, AI-powered system could assist surgeons by analyzing pre-operative data, predicting surgical risks, and supporting procedure planning to improve patient safety and treatment outcomes. The gap identified is that the current system focuses primarily on data storage and retrieval rather than intelligent data utilization. While information is readily available, advanced analytics and predictive healthcare capabilities remain limited. As a result, high-risk patients may not be identified as early as possible, preventive healthcare opportunities may be missed, and healthcare professionals still rely heavily on manual clinical review. To bridge this gap, Gleneagles should implement AI-powered predictive analytics, clinical decision support system, and real-time healthcare dashboard to support data-driven healthcare decisions. The second area is the people gap. Currently, doctors and nurses, pharmacists, administrative staff, IT personnel, and surgeons actively use digital systems in their daily work. Digital technologies are already integrated into patient registration, treatment management, medical records, surgical preparation, and telehealth services. In the future, healthcare professionals will need to work alongside artificial intelligence, advanced analytics tools, automated workflows, and smart healthcare technologies. The challenge is that employees may have different levels of digital literacy and readiness for emerging technologies. While some staff may adapt quickly, others may require additional support and training confidently utilize advanced digital tools. If this gap is not addressed, it may result in slower technology adoption, resistance to organizational change, and increased dependence on technical support teams. Therefore, Gleneagles should continuously invest in workforce development through training programs focusing on AI literacy, healthcare analytics, cybersecurity awareness, and digital healthcare innovation. The third dimension is the skills gap. At present, employees possess the operational skills required to use electronic medical records, telehealth platform, and digital documentation system effectively. However, the future healthcare workforce will require more advanced competencies such as healthcare data analytics, artificial intelligence application, cyber security management, clinical decision support system, and digital healthcare innovation. The current gap exists because most of competency are focused on operating digital system rather than strategically utilizing technology to generate insight, improve healthcare outcomes, and drive innovation. This may lead to underutilization of healthcare data, slower adoption of smart technologies, and reduced competitiveness in an increasingly digital healthcare environment. To overcome this challenge, Gleneagles should introduce specialized digital healthcare certification programs and establish partnership with technology providers, universities, and healthcare innovation centers. Does the current system facilitate work effectiveness? Based on our analysis, the answer is yes. The current digital ecosystem significantly improves effectiveness across the entire patient journey, from registration and diagnosis to treatment, surgery and recovery, and follow-up care. Medical records can be accessed instantly, eliminating the need for physical files and enabling healthcare professionals to make faster and more informed decisions. The digital system improves treatment quality by providing doctors with immediate access to patient histories, medication record, laboratory results, diagnostic imaging, allergies, and previous treatment plans. This helps reduce medical error and support evidence-based treatment decisions. In surgical services, digital systems support pre-operative assessment, surgical planning and anesthesia review, medication reconciliation, and post-operative monitoring. Surgeons, anesthesiologists, nurses, pharmacists, and other healthcare professionals can access the same patient information in real time, improving coordination and patient safety throughout the surgical process. Patients also benefit from MyHealth 360, eHealth Chat, and eHealth Consult, which enable online appointment booking, virtual consultation, health tracking, billing management, and convenient access to healthcare information.
Hi, my name is Nomariam binti Shamsuddin. Next, we look at who benefits from Gleneagles Hospital digital transformation and the weaknesses that still exist within the current system. Firstly, patient benefit through faster appointment booking, easier access to healthcare services, and greater convenience through teleconsultation platform. This improves the overall patient experience and treatment continuity. Healthcare professionals also benefit from quick access to patient information, which is support faster and more accurate clinical decision making while reducing paperwork and administrative tasks. For hospital management, digital system provide better operational oversight, more effective resource allocation, and improved performance monitoring. Meanwhile, the IT department benefit from stronger data governance and enhanced cybersecurity management and better system integration across hospital operations. At the organization level, digital transformation strengthens the Gleneagles Hospital's competitive advantage, improve service quality, and increase patient satisfaction. However, despite these benefits, several weaknesses remain. Cybersecurity risks continue to be major concern because healthcare organization manage highly sensitive patient data. System downtime can disrupt access to medical records and affect daily operations. In addition, many digital services depend heavily on stable internet connectivity, meaning service interruption may impact productivity and patient care. These are also patient adoption challenges, particularly among elderly patients or individuals who are less familiar with digital technologies. Finally, as patient records continue to increase, managing data quality, storage, and duplication become more complex. In conclusion, the hinge analysis demonstrate that Gleneagles Hospital has established a strong digital foundation through the implementation of electronic medical records EMR, MyHealth 360, teleconsultation services, and comprehensive electronic record management practice. These technologies have improved operational efficiency, patient accessibility, and service quality while reducing administrative workload and paper-based process. However, the gap analysis reveals opportunity for further digital transformation, particularly in the area of artificial intelligence (AI), predictive analytics, workforce digital competencies, and integrated healthcare innovation. While current systems effectively support healthcare operations, future competitiveness will depend on the hospital's ability to transform digital data into actionable intelligence and create a more connected healthcare ecosystem. By investing in advanced analytics, AI-powered decision support cybersecurity enhancement and continuous workforce development, Gleneagles Hospital can progress from a digitally enabled healthcare provider to a fully intelligent healthcare organization. This transformation will not only improve operational performance but also deliver superior patient outcome, strengthen organization resilience, and support sustainable growth in an increasingly digital healthcare environment.